Israeli Prime Minister Benjamin Netanyahu has cast his vote in the general election, which will decide if he will lead the government on his fourth consecutive term. Meanwhile, an American healthcare worker who was evacuated from Sierra Leone and is currently being treated for Ebola in the United States is in critical condition. Kristine Domingo will tell us why.
In Israel, Israeli Prime Minister Benjamin Netanyahu cast his vote today in highly contested general election at a polling station in Jerusalem. Netanyahu, his wife, and one of his sons joined the first wave of voters, casting his ballot in Jerusalem. He acknowledged in brief remarks to reporters that his opponent's lead had widened. 5.9 million eligible voters are expected to cast their votes at 10,000 polling stations across the country that will open on Tuesday. Final opinion polls published on Friday predicted the center-left Zionist Union led by Isaac Herzog and Tzipi Livni would take between 24 and 26 seats in Tuesday's vote, compared to 22 seats for Netanyahu's Likud. No single party has ever won an outright majority in Israel's 120-seat Knesset, and the party leader with the best chance of forming a coalition would lead the new government. In America, the U.S. National Institutes of Health in Maryland said that an American being treated for Ebola is in critical condition. The healthcare worker was evacuated from West Africa and arrived at the NIH Clinical Center on Friday. The clinician, who has not been identified, was working with Partners in Health at the medical aid group Sierra Leone Ebola Center. Partners in Health said in a statement that 10 of its clinicians in Sierra Leone came to the aid of their ailing colleague. They were all subsequently identified as contacts of the patient being treated at NIH. The 10 individuals were flown to the United States via non-commercial aircraft to be monitored at designated Ebola treatment facilities to give them access to rapid testing and, if necessary, treatment. The hospital said a fifth person from the original exposure group in Sierra Leone is being transferred to the Nebraska facility for monitoring later on Monday. Partners in Health said the healthcare workers will voluntarily isolate themselves during the remainder of the 21-day Ebola incubation period. Kristine Domingo reporting for Y News.